I say this a lot when we talk about micronutrients, either breaking down different vitamins, breaking down the importance of different macros, different nutritional deficiencies, and it always just boils down to, go to your doctor, see what you're deficient in. But how do you go about diagnosing said malnutrition? If you're not getting enough nutrients, mal referring to the old Latin terminology of lack of, mal, okay, and then nutrition. I don't think that needs any explanation, and if you do, sorry about the large words. I'll slow everything down for your 60 IQ. A new systematic assessment that describes malnutrition in the context of starvation, chronic disease, and or acute disease or injury will help with diagnosis and treatment, nutritionists say. Up to 50% of patients in hospitals and nursing facilities are estimated to be malnourished. And although it is widespread, confusion exists in the clinical community on how to best make a diagnosis. Malnourished patients are frequently not identified as such, and those not affected are sometimes thought to be malnourished. Our systematic approach is the new assessment, is the new approach created for healthcare professionals to enable them to appropriately diagnose and treat malnourishment or malnutrition in patient, said Gordon Jensen, professor and head of nutritional sciences at Penn State. While it may be obvious for a person is suffering from starvation as a result of an eating disorder or depression, for example, is malnourished, it may be less obvious for a person is suffering from a chronic disease such as diabetes or rheumatoid arthritis, or from an acute disease or injury, such as a major trauma from an auto accident or a serious bloodborne infection, is malnourished. Exactly. Patients with chronic or acute disease or injury may suffer from malnutrition as a result of their body's natural and sometimes exaggerated inflammatory response to disease or injury, which can trigger a loss of appetite, normal metabolism, and muscle breakdown, Jensen said. Very interesting, because if you have, a certain trauma that happens in your body, okay, you're not replenishing, ergo, a loss of appetite, you're not replenishing those nutrients into your system, that makes sense. Abnormal metabolism, you're burning things up at a quicker rate that you're not accustomed to. Your body, your normal digestion system can't either catch up to, or it drops off, and then you just don't know where everything is going. And then subsequent muscle breakdown if your metabolism is so high that you're starting to be afflicted by a little bit of muscle wasting, then you don't have any place to put those nutrients or access those nutrients because your A, D, E, and K fat soluble vitamins, if there's no muscle, if there's no fat to store that stuff in, you're running treacherous waters. You're treading treacherous waters, use the correct terminology. Inflammation is an important underlying factor that increases risk for malnutrition. Those patients with chronic disease tend to have inflammation that is chronic and of mild to moderate degree, while those with acute diseases or injuries tend to have inflammation that is acute and of severe degree. That is why, in addition to providing healthcare workers with instructions for determining if a patient is suffering from malnutrition in the context of starvation, chronic disease, and or acute disease or injury, the assessment also suggests that healthcare workers evaluate patients' inflammatory status. That's interesting. Why would inflammatory status just affect your nutrition? Additional resources in your body in order to try to correct an imbalance that's in there is required. Interesting. Different muscle firings that need to happen, different processes that need to be activated that can only be done through certain micronutrients. I could see that being the case. That could be interesting. Ergo, not having those stores required if you needed to spring into action, so constantly being in a state of inflammation, not addressing the root cause is leading to, okay, now I'm starting to see, connecting the dots. I think you guys are, hopefully. This new approach appears in the May issue of the Journal of Academy of Nutrition and Dietetics. All right, dietetics. That sounds like an Aztec king. The new assessment is part of a national effort to educate and implement the use of a more systematic and thorough approach to diagnosing malnutrition, says Jensen. Our hope is to help ensure high-quality, cost-effective care for people suffering from malnutrition. Researchers from the University of Tennessee, the American Society of Perinatal and Internal Nutrition, Mount Carmel West Hospital, the Academy of Nutrition, all those different places as well. Originally posted by Penn State, which is terrific. It's just very interesting how awful how awful inflammation can be in your body. You know, it's mostly the source of a whole bunch of different diseases that are within your body, okay? A lot of autoimmune diseases that permeate your body can be boiled down to inflammation, okay? It's wild. And then dealing with that inflammation, mostly for the fact that it subsists and it continues to grow and radiate throughout your body thanks to your diet, and it's something that you can fix, okay? And then by eating a proper diet, you also solve a micronutrient malnutrition issue that you might have in your body. So it's amazing. It really is. Whenever I think of any problems that run into my body, like if my back is starting to feel a little bit tight, okay, my hips are hurting a bit, my knees are a little bit off, I could be thinking, interesting. What has my diet been looking like lately? Okay, have I been eating at correct intervals? Have I eaten too close to bed? Has my body had time to properly digest everything in order to work through everything, in order to absorb it so it doesn't just sit there and just kind of gestate or spoil in the intestines and raise up other problems? If I had anything with gluten or dairy on top of that, which stimulates inflammation, had any sugar leak into the diet, anything like that happens, and then okay, because not my personal medical history, but my lineal medical history, extended family, okay? What I inherited gene-wise, it's a train wreck, so I need to keep on top of myself. I need to keep in proper physical condition. Otherwise, a whole bunch of different goofy things can end up happening. So yeah, if you cultivate your diet around trying to reduce inflammation, you can also work on it, consequently, deal with malnutrition without even knowing that you're actually addressing that. So might be killing two birds with one stone right there. So guess what? Eating a clean diet could solve a lot of your problems. And then also properly hydrating as well. That'll definitely, if you're feeling sluggish and you can't quite figure it out and everything else is on point, just drink a little water. Everything will be fine. With all that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.